when autism diagnoses in adulthood ties to increased burden of psychiatric conditions. Welcome back, friends of Ai4Autism. In this episode, we're taking a look at the following Spectrum News article by Charles Q. Choi called Autism Diagnosis in Adulthood Tied to Increased Burden of Psychiatric Conditions. Let's begin. People diagnosed with autism in adulthood are nearly 3 times as likely as their childhood diagnosed counterparts to report having psychiatric conditions, a new study finds. Experiences of childhood versus adulthood diagnosed people are likely to be quite different, says lead investigator Vanessa Ball, Karmazin and Lila Chair in adult autism at Rutgers University in Piscataway, New Jersey. Generalizing findings from one group to the other is going to have serious implications for research. The substantial differences between these groups suggest studies reporting outcomes for adults with autism are now incomplete in their conclusions if we do not know when the diagnosis was made, says Eric Butter, chief of the psychology section at Nationwide Children's in Columbus, Ohio, and director of the hospital's Child Development Center. Butter was not involved in the study. Increasingly, studies of autistic adults involve people identified later in life, in part because of the expanded diagnostic criteria for the condition and online surveys that make it easy for participants who live far, far away from the researchers to join in. But little is known about how these adults compare with those identified as autistic earlier in life. The new study drew on data from 4,657 legally independent autistic adults, including 2,826 women, from the Simons Powering Autism Research Knowledge Spark project. The 2,210 participants diagnosed with autism at age 21 or older were 2.7 times more likely to report co-occurring mood, anxiety, personality, or eating disorders than those identified with autism in childhood, the researchers found. Adulthood diagnosed people also reported more lifetime psychiatric conditions, an average of 3.2 versus 2.8 in their childhood diagnosed peers. We don't know if this is due to their being misdiagnosed with other conditions or whether those diagnoses, for example anxiety, depression, may be the effects of living without proper autism diagnosis throughout childhood, adolescence and beyond, Ball says. Probably both are factors. The findings suggest diagnostic tools and processes need involvement to enable earlier diagnosis for autistic people with co-occurring mental health conditions, says Micah Mazurek, a Novartis U.S. Foundation Professor of Education at the University of Virginia at Charlottesville, who is not involved in the work. When children or adolescents don't receive a timely diagnosis, they miss opportunities for appropriate services and support that are tailored to their unique needs, Mazurek said. They also miss out on opportunities to build self-understanding and connections within the autism community, placing them at greater risk for negative mental health outcomes. The study supports previous work that uncovered a high prevalence of psychiatric conditions among autistic adults in general. As a whole, those in the new analysis have 3 psychiatric conditions on average, with women being 1.7 more times likely than men to have co-occurring conditions such as eating, anxiety, and affective disorders. The results published on the 29th of August in Autism Research underscore the mental health crisis facing autistic adults, Ball says. More autism training is needed for all mental health fields at all levels, and not just in pediatric care, but in adult care too, she notes. And the article touches on a little bit more. You can cite this article down below over here, but tell us what you think so far. What are your experience on this? What are your thoughts? Like, share and subscribe and comment below. And remember, love, life, and AI.